Hey, this is Dr. Bob with Carolina Value Pet Care. Thanks for joining us today. I'm going to talk to you today about intestinal parasites. We can occasionally get questions about the different parasites, but one thing I need to make very clear, there is a difference between heartworms and intestinal worms. Heartworms can be life-threatening. They live in the heart, they live in the lungs, and they can cause significant damage. And as I mentioned, they can be fatal. It is treatable, but we prefer to prevent the disease in the first place, and we have a stunning array of different heartworm preventions available. Now, intestinal worms live in the intestinal tract, and there's typically 4 different ones that we commonly see in this part of the country. And in no particular order: roundworms, hookworms, whipworms, and tapeworms. Now, roundworms and hookworms, very, very, very common in puppies and kittens. I would say 85–90% of all puppies and kittens have hookworms and roundworms. They can actually get them from mama dog or mama cat, either through the placenta before they're born, or they can get it through the milk while they're nursing. Now, that's why we commonly want to start deworming puppies and kittens at a young age, because it's in all likelihood they have one or the other or both intestinal worms. Roundworms can be seen, and if you ever see them, they look like skinny pieces of spaghetti, and they can be several inches long. And usually, when you see them pass, you'll see almost looks like a little ball of string with all these little moving little worms. It's really disgusting. The good news is you cannot get them from direct contact with your puppy or your kitten. Now, the hookworms you cannot see, but we're actually more concerned about hookworms than roundworms, because the hookworms can latch on to the intestinal wall, and they are voracious bloodsuckers. So unfortunately, with small kittens, small puppies, they actually can be fatal, just because they can actually suck so much blood that it can actually kill an infant or a very small puppy or kitten. Now, easy to get rid of. So when we first see puppies and kittens, we'll generally start seeing them at about 6 weeks of age, and we like to get them started with a dewormer to get rid of the intestinal worms at that early age. And of course, we continue the discussion about prevention later on. Whipworms, not typically in puppies, but common in dogs that like to get out and eat grass. In fact, I should mention that hookworms, very common in dogs also, that get out and graze, that like to, snoot around in the dirt, that, eat grass, or just like to grovel on the ground. So they can get it from ingesting the grass, because the larva of these worms is actually in the environment. So that's true of hookworms, also with roundworms, but most older dogs do develop a lifelong immunity or protection against roundworms. But very commonly, adult dogs, hookworms, and whipworms, again, from eating grass. Tapeworms, that's the 4th one. Tapeworms are completely different from the other 3 worms. Now, how is it different? Quite simply, when we check a stool sample, checking your dog for intestinal worms, when we see intestinal worms, we're typically going to see roundworms or hookworms or whipworms. Why? Because those worms lay eggs in the intestinal tract. So when we look under a microscope looking for intestinal worms, we're looking for the eggs, because the eggs are passed in the stool, in the poop. Totally different with tapeworms. Now, tapeworms also very different, because they do not get the tapeworms from eating grass like they do the rounds, the hooks, the whipworms. They get the tapeworms from either ingesting a flea or from eating small mammals. Chipmunks, mice, moles, squirrels, rabbits, not from birds and not from other insects, just the flea. Okay? Now, with the tapeworms, there's 2 different kinds: the one they get from ingesting fleas, the one they get from eating a small mammal. Each of those worms can get inches and inches and up to 2 feet long in some cases, but they're made up of individual segments attached end to end, much like a train. And sometimes you'll actually see those individual segments. They will break off, and actually they can be passed on the poop, or they can actually just wiggle their way out of the rectum of a dog. And sometimes you lift the dog's tail and you see the tapeworm that's wiggled its way out of your dog's rectum. And when sometimes you can see it looks like a dried bunch of sesame seeds attached to the tail area. And again, those are just dried up tapeworm segments. So why is it different? Well, we do not see the tapeworm eggs in an intestinal stool sample. That's why we typically don't do stool samples, because even though tapeworms are extremely common because of fleas, and also a lot of cats that like to hunt, or occasionally dogs that like to hunt, that get the tapeworms, we almost never see evidence of tapeworms in a stool sample. So, not to say it's useless, but again, it's very common to see tapeworms, but we generally rely on the owners to see evidence of the tapeworms. Stool samples will almost never show evidence of the tapeworms because the eggs are not in the intestinal tract. The eggs are in those little packets that are passed in the poop, okay? Now, we do have medications that can easily get rid of all 4 intestinal worms, very easy to do. We have 2 different heartworm preventions, Sensible Spectrum and Interceptor Plus, that are heartworm protection in addition to treating and preventing month over month all 4 intestinal worms. Now, there are also 2 other intestinal parasites that are not worms, they're parasites. One is called Giardia and the other is called Coccidia. Coccidia is primarily in kittens, more in kittens than in puppies, but we do see it in puppies sometimes, and it can cause really sort of a raging diarrhea. Easy to get rid of, but quite common, especially puppies and kittens coming from really unhygienic conditions. The other intestinal parasite called Giardia is actually quite common, but fortunately most animals don't exhibit any clinical signs or symptoms. But what they do, if you have an abundance of the Giardia, it can cause some really nasty diarrheas in dogs. But we do have a treatment for that as well. So that's kind of an overview of the different intestinal worms and intestinal parasites. I know that's a lot to digest, but pun intended, but hopefully that will give you some information and help clarify the differences in the worms that we see. Thanks, and make it a great day.